This is going to be the first video of a series I'm making called 1,000 Ways to Help Pain, because there are so many, and there are a bunch of like weird ones and different ones. There are so many different ones. I'm going to be making more videos in depth about different ways, like less common ways to help pain, but this first video is going to be all about normal pain medication, like your classic ibuprofen, stuff like that. I wanted to give a list of pain medications just so people know what's out there and they can talk to their doctor about it. First of all, I wanted to say this is not medical advice. This is only for educational purposes. Do not take anything I say into like serious I'm not a doctor. Okay. I'm not a doctor. This is not medical advice. Please talk to your doctor about any medications you're taking. This is just for educational purposes. I'm out of breath. Oh my goodness. So the first set of medications I want to talk about is anti-inflammatories. This is usually the first thing that they start with when you get to the hospital and you say you're having pain. They're going to be like, hey, have you taken ibuprofen? Have you taken Tylenol? That's their two go-tos all the time. And usually when people hear those words, Tylenol and ibuprofen, they're like, oh man, they're not gonna help my pain. But that is just what they start with to see if that's going to help. Because if it can help, that is the best, like, least side effects, the least dangerous type of medicine is ibuprofen and Tylenol, so they're always going to start with that one. Another anti-inflammatory that is good is naproxen. They usually give this to patients with arthritis. There are lots of other types of medication that are like naproxen that you could ask your doctor about. You could say just like, hey, what's a medication that's similar to ibuprofen or something like that. And if ibuprofen isn't working for you, ask them, hey, what's something stronger than ibuprofen that I can take that is an anti-inflammatory. Another good anti-inflammatory is Toradol. It's often used in the ER. This medication, you can only take it for about 5 days. Like, after 5 days, it starts to have more effects on the body. I don't remember what the bad effects are, but they will not give it to you for more than 5 days. But it is an anti-inflammatory. It's like ibuprofen, but stronger, essentially. And then the next the next anti-inflammatory up above that, the stronger one, would be steroids. By the way, this is not the same type of steroids that people take like when they're juicing. It is not the same thing. When people say that they're juicing, that is usually like hormonal steroids, and those are a lot more dangerous. At first, I was afraid of steroids. I was very afraid because I thought that they were trying to give me like the hormonal steroids that athletes usually take, and I didn't want that. I didn't want any of the side effects. Those are really dangerous. They can have effects on your fertility, and they can have effects on so many things. But one of the classic steroids that you're given is prednisone. I was actually on this for at first I had a 5-day course of this, and it was an absolute like miracle drug. It took away all of my pain, and like I said, I was afraid of it, so I was kind of hesitant to take it. But after I did, I was like, oh my goodness, I didn't know that this is like actually a good drug, you know? After that, I got put on a 2-week course of steroids, and my pain did come back. By the way, these anti-inflammatories, they are not going to fix any underlying problems. They're not going to fix anything. They're just going to decrease the inflammation so you're not in so much pain. So it's kind of like a temporary fix, like like I said, a miracle drug. Lots of doctors call it that. So the next type of drug is opioids. Now this has a lot of controversy. Most doctors, I don't want to say most, but a lot of doctors are really uncomfortable with prescribing opioids. They are scared of it. They don't want their patient to OD. They don't want to get that call one day saying, hey, your patient blah 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 was found dead. That is why they're always saying, hey, if if you have these medications, you should also get naloxone just in case. And naloxone, I don't know what it does chemically, but it helps with overdose. Like if someone is overdosed, you can give them naloxone and it will save them essentially. So this naloxone is very essential to get. I don't have any, but they offer it for free at most hospitals. So there are lots of different types of opioids. Usually the classic one they start with is hydrocodone. It will have usually a little bit of Tylenol with the opioid in it. The way these medications work is they change the way your brain processes pain, and it's through the opioid receptors. They have lots of different types of these. They have like the standard normal ones, they have instant release or immediate release, and they also have extended release. There are pros and cons of each of these different ones. I would suggest researching them. I asked my doctor for immediate release because my body has kind of a hard time absorbing pain medications. Like for me, it takes 2 hours for it to start kicking in, whereas some people it will take 30 minutes, 60 minutes. Like it's different for every person. But for me, it takes about 2 hours for normal medication to work. So I asked for immediate release so that way it could kick in sooner and I don't have to wait that extended time to have pain relief. I don't know much about extended release, but I know it lasts about 12 hours. It has a certain thing in it that makes it release at a certain time, so it will be slowly releasing throughout the day instead of just releasing all at once. So this is different from the immediate release where it lasts about 4 to 6 hours. They also have pain patches you can get, like transdermal, I think that's the correct word. It's like a nicotine patch, but it has pain medication in it. And these last about 12 hours. Like they should last you all day. These are similar to extended release in the fact that they release slowly at different times, so that way you have a level of pain medication in your body. There's also gabapentin. This medication is usually used for seizures and people with neuropathy. It is a nerve pain medication. It's a nerve blocker. It makes your neurons fire less. That's why it helps with seizures. When people have seizures, their neurons are firing too fast. There's too many neurons, and then it causes there's too many neurons firing, and then it causes seizures. So that is why gabapentin helps with seizures. But it also helps with pain in the fact that it blocks the neurons from firing, and then you don't feel the pain as much. This medication, it's hard to dose. They usually start you out with a super low dose and then work your way up until you have pain relief. So if you're getting this medication, don't expect just to get a high dose straight away. You usually start with the small dose, and sometimes the small dose works for people. They'll usually start with 100 milligrams 3 times a day. This medication works best if it's in your body like constantly instead of I can't breathe. Sorry. Please forgive me with my not being able to breathe. This medication usually works when it is in your body constantly, so taking it 3 times a day, and instead of just only taking it for pain relief, it will work better if you are taking it every day instead of just when you're in pain. The cows are staring at me. They're listening to my podcast. Hello. Hi, cows. They're like, what is she doing? Make sure to talk to your doctor. If you need any of these pain medications, bring it up to them. It's very easy. It's easier than you think to talk to your doctor about pain medication. Like I'm always scared at first because a lot of doctors have they're kind of like against it, or they don't want to prescribe it, or like stuff like that. I'm always afraid of them judging me, but make sure to bring it up. Like don't just skip over the conversation because you're scared, because they can help. There are some doctors that don't want to prescribe them, and there's some doctors that are okay with prescribing them. What you could do is just ask them, hey, are you comfortable prescribing pain medication? Because that is something I need. And if not, I can go to another doctor who is comfortable with it. So yes, make sure to talk to your doctor. Don't be afraid. Just be honest with them. the more honest you are, they can kind of tell this and be more receptive. Like if you're lying to them, they can kind of tell, and they think you're trying to like get something out of them. So just make sure to be honest about your symptoms. Tell them about how it affects your day, how your pain affects your day. Like for example, you could say, my leg hurts and it is hard to walk to the bathroom sometimes. It's hard to stand to brush my teeth. You could say, give them examples of how your pain affects your day, and that will help your case a lot. Okay, so I think that is pretty much it. Remember, this is not medical advice. This is all just information, educational purposes. Make sure to talk to your doctor about all of this. This is not advice, okay? I'm not a doctor. I'm just a patient who knows a lot. Bye!